May is Mental Health Awareness Month, and here at Studio 10 we like to connect you with resources available in our community, and I'm with Jennifer, who's a therapist. Tell me a little bit about those resources that are available. We've had a tough couple of years.
It has definitely been a very stressful, very long 2 years. And so we're really encouraging folks in the Tri-County area and everywhere to be aware and take care of themselves. That looks different for every individual. For some of us, it might be accessing resources available in our Tri-County area. For some of us, it might be practicing new skills that we've learned that we find relaxing. And for other people, it might mean connecting with a mental health professional like a therapist or a counselor.
Now, how is it different for adults and kids? I know the resources are different and the problems they're facing are different.
Honestly, I would say it's really not that different because we're all humans and we're all looking for different ways that we're going to take care of ourselves. What we're finding, especially working with our young people, is actually when they have that trusted adult that they can engage in some of those activities with, that forges those good relationships and that helps keep everybody's mental health safe and happy and healthy.
And what would you say has been the biggest issue or problem you've seen of people coming in the past couple of years? Like, what has the pandemic changed about the way we live our lives?
We've definitely seen an increase in anxiety and in depression among both our youth and our adult populations. We're all feeling stressed out, we're all tired, we're all looking for different ways to sort of ease the different crunches that we've felt related to the pandemic and everything else that's happened. So I think whether we're talking about our adults or our kids, we are seeing some really kind of common threads of those increases in anxiety and depression.
And it really doesn't discriminate amongst populations, right? This can affect everybody in all walks of life, whether you're making all kinds of money and you're this end of the spectrum all the way down. It really doesn't discriminate, right?
Precisely. 1 in 5 of us, no matter what age group we're talking about, 1 in 5 of us are going to struggle with a mental health challenge at some point in time during our lives.
Okay, so we've kind of talked about the problems we're facing. Now, what are the resources that are available? What can be done about all of this?
The Tri-County area is really innovating, and we're really looking to be a leader in providing resources and providing supports. We're doing things, everything as varied as groups out in the community. We've got groups for our young people, we've got different resources for adults, and we've got different options when folks find themselves maybe in a state of emergency and they feel like they need help now. They don't have that time to schedule an appointment with a therapist or an appointment with a counselor. They need resources in this moment. They can either come to us here at Community Mental Health, our emergency services. They can go to a local emergency department and see some of our fine medical providers, or they can look at some of the national resources like the National Suicide Prevention Lifeline.
Yes, and now Jennifer, of course, that would be the best, is to make the appointment, come and talk to a therapist. But are there any little tips you have for us of, like, if we're kind of leading up, we're waiting for our appointment to come, are there any little tips you have for us as far as maybe like breathing or journaling? What's the best for us while we're waiting for our appointment?
I think each of us is sort of in a spot where we can find which skills work best for us. We have lots of folks who do enjoy journaling, but if you find that you're someone for whom that just doesn't work, that's okay too. There are apps out there that can help us meditate or help us monitor our breathing. And I know sometimes folks hear the word like meditation and think, oh no, that's not for me. I can't sit in utter silence for 5 minutes. It doesn't have to be sitting in silence for 5 minutes. It can be very structured, very guided. If you're someone who doesn't want to bring tech into that moment of relaxation, taking a 5-minute walk outside, stretch your legs, move your body, refill your water bottle. Things like making sure that you're getting good sleep, checking in on how are your food choices lately. Just those little things that we do to take care of ourselves as sort of holistic human beings also improve our mental health, because we're not just minds, we're not just bodies, we are whole integrated humans, and being able to pick and choose those different skills or those different things that help us feel well can also then improve our mental health. Great
tips. And like you said, Jennifer, we're all different, so it's going to affect us differently, and one thing's going to work for this person, not going to work for the other. So where do people go if they want more of these resources?
There are many fantastic sources out there. Anything from the American Foundation for Suicide Prevention has some fantastic mental health and wellness tools. There are apps like Calm or Mindful Minute out there. There are different activities that you can find on YouTube, or even if you Google, I'm looking for mindfulness for my age group, or I'm looking for mindfulness to share with my child or my partner or my friend. You'll have lots of different resources available at your fingertips.
All right, Jennifer, all great tips. Thank you so much for those tips today.
Thanks, I appreciate it.
All right, stick around. Studio 10 continues after the break.